Well, it is sad that so many Americans suffer from neck and back pain and don't seek treatment. But I think one of the reasons many people don't is they're afraid that the treatment is going to be as painful or more than what they're already experiencing. That is not the case with Dr. Jamie Kaiser, who joins us here this morning to talk about a type of treatment that is so gentle, some people don't even think you're doing anything until they suddenly find that they're pain-free.
We always describe the first adjustment in our office with Nuka Care as extremely underwhelming. I mean, most people, and maybe Brian will talk about this later, but the most amount of force it takes to actually make a correction in someone's body using the Nuka procedure. If you've ever had your pulse taken, we're talking about slightly more pressure than that.
And I'm hearing from a lot of folks, my mom included, I have to tell you, that have said she's really intrigued by this because she's heard so many people come on here and talk about how much better they feel, but how they were surprised by how gentle the original adjustment with Nuka was. So, Brian, let me talk to you for a second here. Brian Best, you grew up here in San Diego?
Yep.
And so obviously you're a very active lifestyle. Everybody here tries to be involved in a couple of sports. What kind of things were you into?
I played golf in high school, surfed all my life, impact sports, skateboarding, you name it, just a kid jumping off roofs, you know, just the normal kid.
Well, let me ask you this then, because this probably applies to everybody, Doctor. As kids, when we're out playing and doing things, you're going to have some kind of trauma to the body just normally as a kid.
Absolutely. You know, you look at, I've been doing this kind of work over 5 years now and about 3,000 patients. And if you look back over that history, you talk to Nuka people, worldwide Nuka doctors that do this kind of work, by the age of 7, half the kids are actually out of alignment based on how we're going to define it. By about the age of 15, every single person has done enough trauma to this upper head and neck area where everything in the world has to pass through to move things out of place. And so, you know, by the age of 15, we know that there's something not in the right place.
Now, Brian, do you remember any incident in particular that you think, ooh, looking back on it, maybe that's where I got knocked seriously out of alignment?
Yeah.
You do?
Yeah, funny thing is that it kind of comes back to you, and I don't know if it's true with everybody, but me it's kind of like, I remembered I always got a hot spot in my neck when I looked over my shoulder. And then after Jamie's treatment, I remembered when I was a kid, reaching for a football over the shoulder, wham, hit into a palm tree. And it's like, and Jamie's got the x-rays. My head, when he saw me, was 7.5 degrees out, and it just turned my shoulders this way, my hips went this way, and it's like I spent my whole life trying to, you know, balance things out, trying to figure out.
So what'd you go, was it 30 years kind of out of alignment?
I'm 48 now,
just
yeah.
Thinking, now this is normal, I'll compensate. You don't even consciously even think that, probably.
No.
You just go on about your life.
Exactly, and you get used to it. And for me, construction, I do landscape construction, and I've done that for 15 years, and it's like I would get out of bed, I was telling Jamie that at night, go to the bathroom, and so I knew where the bedpost was, I knew where the dresser was, I'd make my way to the bathroom, you know, go back to bed and then just crawl back in, and it felt good, you know, but I was in pain the whole time, I didn't realize it. 2.5 weeks after seeing Jamie, I got up, went to the bathroom, and it's like, wait a sec, this is different. This is different. And I went back to bed, and it's like, wow, there's no pain, you know, and it's like, first time in my life, well, since I was 13.
Well, then let's talk about Nuka treatment then, because here's the thing that absolutely floors everybody, and it's the kind of the hurdle they have to get over sometimes before they pick up the phone and call.
Right.
It's so gentle. You make some measurements, you find what's out of alignment, and then you very, very gently, as we're seeing here, after making these measurements, just make a slight adjustment. And what is actually happening there?
Less is more.
Okay.
We keep thinking that we need to do more and more work, more and more high tech to get help. And the reality is that because we're working up in that upper head and neck area where, again, every single nerve in the body has to pass through, if you're specific, if you're scientific, you can figure out and be very technical in getting that area corrected. Changes can happen throughout the whole entire body. It's all about the leverage. It's all about the physics, the math. We take very specific x-rays, specialized set when someone comes in for the first visit, so we can figure out how to correct that upper head neck area. Actually, 10,000 different combinations between how the head and neck can misalign.
Yeah, it's interesting because I told you about my mom, you know, being very interested in this now. She finally, after watching these segments, said, I get it. It makes sense. Everything has to travel down through that neck, all the nerve bundles and everything that are there.
Everything.
Branching off to the rest of the body. And if she figured from watching this, if you're just slightly out of alignment, there's no telling what is being pinched that's affecting some other part of your
Everything
body.
is down below. If everything in the world passes through this area, then by default, if we reverse that logic, if this area is out of place, anything can be wrong.
So, folks, if you're suffering any kind of back pain, discomfort, but it goes way beyond that, doesn't
his
it?
golf swing changed. His shot changed.
Yeah, my whole life I've been playing a slice, and I can control it,
Right.
But now that I'm straight, it's like I got a nice little draw, I can pull that ball over. It's like, wow, this is great.
That's funny. Now, be honest with me, though. The first time you laid down there on the table after, having your full exam and you had your first adjustment, did you think anything had happened?
I thought Jamie's wrists were clicking. He says, no, it's not your wrist. And it's just a little gentle click, 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 click you hear in there as he adjusts the atlas. And it must be moving, I take it, but that's all you hear. And he says, no, let me do my wrist over your ears. And there was nothing coming from his wrist, so it must have been my
But
atlas.
it didn't hurt. It wasn't
No.
uncomfortable.
No, it's a
And you
nice,
got relief, you said,
comfortable
within about
table.
2 weeks.
Well,
2 weeks.
First, when you got home was at the shower.
Oh, yeah, I was in the shower. And I told Jamie the next time I saw him, it's like usually the shower hits me in the shoulders, it feels good. I could wash my hair backwards and I could get that water to come down over my head. And it's like, wow, it's like I'm straighter than I've ever been in my life.
Wow.
It's amazing.
Well, let me offer folks, or actually I'm going to let you make the offer here, for a new patient special. And I really want to make sure that we give folks all the details so they really understand what this is. Initially, this is absolutely free. This is not going to cost you anything to come in and see the doctor and be evaluated. Right. But there's a couple of conditions we want people to meet because, quite frankly, your schedule is full.
Our schedule is full. This is very, very valuable, and I take this work very seriously. We have a good time in the office, but this is serious work here. For the first 12 callers, if they call and make the appointment, they schedule it for later this week, no charge for the exam and the consultation. We will go through every single question that a person has. If they decide to move forward to get the x-rays taken, it's only $49.
Now, that would normally be over $200 to have the
$200
x-rays,
value.
but the exam will be free, the consultation will be free, and if you move forward, it'll only cost you $49 for the x-rays, which are normally $200. Now, the only other thing that you ask is that folks, when they're going to be calling into a call center because of the volume of calls, you need that call center assistance.
Right. They're going to make the phone call right now to our office. It's actually going to our call center, and we will get, Mark, anywhere from 10 to 30 phone calls in the next 5 minutes. And so to protect everyone's appointment time, we do require a credit card number just to hold or reserve that new patient appointment time.
But that credit card will not be charged unless you fail to show up for the appointment.
Right. And we do have a 72-hour reschedule/cancellation policy. We just got to make sure that those slots stay filled so that we're not pushing people that want to get help. We're full for the next 3 weeks. I don't want to do that to people.
Understand your credit card will not be charged unless you decide to move forward with the x-rays or you just don't show up for your appointment.
Absolutely.
I think that's only fair to the doctor.
Absolutely.
Jamie Kaiser, thank you so much.
Thanks so much, Mark.
Brian, continued good health to you.
Thank you.
Thanks for coming in and sharing your story. And the first 12 callers, take advantage of that offer. And if the phone lines are busy, please just keep calling until you get in there. Doctor, great to see you. Brian, good to see you. For more information, you go to san diego6.com and you click on San Diego Living.